Well, good afternoon, everybody. Today is Friday, March 19th, 2021. My name is Scott McGann with the Falmouth Health Department, doing your weekly COVID update for the town of Falmouth. Our email is www.falmouthma.gov. Email the health department or call the health department for non-vaccine COVID questions, could be complaints, things of that nature. Our email is health@falmouthma.gov. 508-495-7485 is the direct line to the health department. The county County Health Department, Barnstable County, has a COVID hotline as well, 774-330-3001, also not for registration. We'll talk a little bit about registration in a second. So the governor changed the guidance this week as far as who's eligible, not guidance, but who's eligible for vaccinations. So starting on 3/22, so this upcoming Monday, individuals age 60 or plus and workers in certain sectors, such as, and I'll talk about that in the next slide actually, so we'll talk about that in a sec. And then on the 5th of April, we're talking individuals 55 and older and any individual with at least one certain medical condition, otherwise known as a comorbidity. And then on 4/19, so April 19th, any individual above the age of 16 would be eligible. So it would be opened up to everybody in just about right around a month. So here we are. As far as the eligible working workforce, it's restaurant, cafe workers, food, meat packing, beverage, agricultural, consumer goods, retail or food service workers, grocery, convenience stores, food pantries, medical supply chain workers, vaccine development, transit and transportation workers, public works, water, wastewater, other utility workers, sanitation workers, public health workers, and court systems of court system workers who are already not part of phase one. I believe some of the court officers were already as first responders, funeral directors, and funeral workers. So there's a list that's extensive. We put this presentation up on our website if you want to go back to it, or I can just pull this off of mass.gov as well. You can get that right there as well. So those individuals in those sectors will be eligible starting on Monday. So again, going up there, that was the workers eligible on 3/22. So the state's changed. I brought this up on the last week. You can pre-register at the state sites only. So the sites at the Barnstable County that we run at 4Cs, that we run at the fairgrounds and elsewhere, there'll still be an online registration time where everybody's first come, first serve who gets registered. Because the state hasn't given, other than their mass vaccination site, the ability to pre-register. But you can pre-register. So if you're 22 and you're going until the 19th, you can start registering, and then they'll just, when your time comes up, you'll be able to, you'll eventually get a notification from the state, and that's just for mass vac sites, which would be like Gillette or Dartmouth, a couple in Boston here and there. So nothing local is a mass vaccination site as far as the state is concerned. Okay, so that is something that you can do if you haven't done it already. It looks like this, asks you some information, and you fill out the pre-register form, and then they'll contact you when there's appointments available, and you have 24 hours to select it. And then that's something that you can do as you continue to look at the pharmacies and the county-run sites that we have. And as you're looking for one, you can always have that in your back pocket as waiting for when you might get notified from the state. How are we doing with supply? Well, we're doing better with supply starting next week. So vaccines still, limited. We're getting a three-fold increase in doses being sent to the county starting next week. So instead of 1170, we're getting 3,510, which is 3 cases of Pfizer. Next week, we'll be doing 3 clinics at the 4Cs, Cape Cod Community College, 900 doses each. The registration happened this morning. It'll be Pfizer. Okay, those will be first doses. The county's still doing second doses from everybody that was done with their first dose, so that's kind of what happened this week. It was still on the second dose clinics, so a lot of it. Some of it. No, I think we were at first dose last week, and then the week before was mostly second dose. So we're doing both, I think, this past week. We're doing both single and double, first dose and second dose, sorry. Doses will be rotated through the county vaccination sites. Starting in a couple weeks, will be, and as the weather's getting a little bit better, because that is, the fairgrounds is an unconditioned space in the barn. There'll be more at the Barnstable County Fairgrounds in the upcoming weeks. Okay, the regional vaccination sites for the county, the 4Cs, Barnstable County Fairgrounds, the Orleans DPW, and then there's one on the Lower Cape. Also, pharmacies, a lot of people are having success at the pharmacies, so you can keep checking with Walgreens and East Falmouth CVS. Veterans can still call the VA, but you would have to go up to Brockton, West Roxbury, or JP, Jamaica Plain, for that. But you can contact your veterans for that information. So the supply is getting 3 times better than it was up until now, so that's great, and we'll be giving those doses out in very short order. In terms of the Cape Cod Regional Vaccine Consortium, this is very important if you're over the age of 65. If you're over the age of 65 and you've been left out because their inability to register yourself at the clinics, you want to call the Senior Center, 508-540-0196. If you've been left out in the cold for vaccinations. I'll talk about how we're doing for vaccinations in a moment. But if you've not called and you're listening to me and you've had no luck getting a vaccine because your inability to register and fight online for that, call the Senior Center. If you're truly homebound, if you cannot make it anywhere outside, you're very limited in your ability to get anywhere, call the Senior Center. We have the Community Health Center of Cape Cod working on homebound. We have Cape Cod Healthcare also at the 4 Cs, so they're doing it at the same place the county's doing their clinics, is calling directly and scheduling you for a vaccine if you're vulnerable, if you're elderly, if you're over 65, and you need a shot and you just haven't had any luck. We've had very, very, very good success with Cape Cod Healthcare. They're getting doses from the state and giving them out quickly. So again, that is what you need to do is if you've been left out on vaccinations. Early education K through 12, so the teachers, there's going to be designated educator vaccination days is 4 days only, set the 27th of March, April 3rd, April 10th, and April 11th. You can schedule through mass.gov. Pharmacies are also going to be available. Barnstable County Health is also working on getting some clinics. Now that we're getting an increase in doses, we're going to post that shortly. And Cape Cod Healthcare has also been working for the group. So reach out to, go on mass.gov, check the pharmacies, and keep an eye on the Barnstable County website, working on trying to get all the group here that's on the right, the educators, after-school programs, bus drivers, custodial staff, things of that nature. Okay, so you are eligible, and if you're, and that's your different avenues, and more to come, more detail will come out as Barnstable County is able to set up some clinics. Pharmacies, you'll have to go directly to them, and also mass.gov for those 4 dates, you'll also have to go to them. So that's where we are with early education. As far as vaccinations, the cumulative percentage of individuals with at least 1 dose administered by a county. So 35% of the county has received at least 1 dose, which is up 4% from last week. The number of individuals fully vaccinated, meaning they've received their 2nd dose, or they went with the Johnson & Johnson, which would be considered fully vaccinated after 1, we're up to 18% or 5% increase over last week. So we're making progress. The doses that are allocated are going out into arms, and that's what we really need to be doing, and that's what we are doing. So I like this chart here. This comes from the state every Thursday. So this tells you where Falmouth stands. Very similar to all the Cape towns. So we're all sort of in the same plus or minus a few percent here and there. So age 75 and older, there's 4,548 residents. 87% of them have received at least 1 dose. 63% are fully vaccinated. And now a lot of that has to do with Cape Cod Healthcare, the list that we provide. When you call the Senior Center, we provide the list of Cape Cod Healthcare once or twice a week. They make the phone calls, and you go down and get a shot at 4 Cs. That system's worked really well. It's also worked, obviously, that yourselves or your family members have helped you get to sites, the mass vac sites where most of the vaccines have. But either way, you have been getting, if you're over 75, we've done a fairly good job, up to 87%, at least with their 1st dose. 65 to 75, which was opened up just a few weeks ago, is 69% with 1st doses and 18% fully vaccinated. Obviously, as you get to the groups that we're not open to, unless you were a first responder or you met certain criteria, it's going to be less. But even the 50 to 64s, we have 27% with 1 dose and 14% fully vaccinated. So those numbers are increasing. There's just, it's sort of a consistent increase. And obviously now as the guidance changes more, the youngers will start getting done as we've been able to do fairly well with the 65 and olders. Total would be 36% of the town has received at least one dose. So again, if you've been left out and you're a senior, you can see where your neighbors that are the same age of you in the same town has had good luck going through the senior center or getting to a mass vac site. If you're being totally felt like you're being left out on here, please call the senior center, and they'll put you on that list, and you will be called by Cape Cod Healthcare. It's really been a bang-up thing that we've been able to do, and that's through the consortium of Senator Sear and Moran and Dillon and Fernandez, and they've all got, about 3 or 4 weeks ago with the state worked this deal out with Cape Cod Healthcare to do it. The current system that we had was just not working for our residents, our senior residents. So that's it for vaccines. We've done, like I said, we're making progress, and we're getting more doses, and it's going to start opening up to those that are younger, which makes it more difficult for those that are over 65. So if you're really having trouble registering, again, call the senior center. As far as our cases, we had 25 cases this week, where our case count is 1,254 since the beginning of the outbreak, which was a year ago. So the outbreak on March 19th, it's now March 19th of 2021, so it's been 1 year. 17 probable cases since the start of the month. We're about 11.5% of all cases in Barnstable County with 14 of the population, so we've done better than average in the county. Of course, the VNA, the CDC, the state, and the health department, we're still doing the contact tracing that we've done since day one. So that's where we're at. So if you look at the chart that I do every week, you can see that we've had about 6 weeks of consistently in that 5 out of the 6 weeks right around 25 with 1 week over 30. So in that 25 to 35 range, it seems sort of like a baseline similar to that we had this past summer from like June to early fall, mid-fall, that we were averaging less than 10. And we were sort of staying in a really flat, it seems like our flat line baseline right now seems to be in that 25 range. Obviously, it's not the summertime. The virus does better when it's cooler and drier. It also, we're indoors more and all that stuff. So that's where it seems like our baseline is right now. So that's where we are, and that's, where we've been. And again, we can see that curve was really, really high back from December into early February, and we're seeing to sort of starting to flatten that out with a consistent 25 or so week. Yellow, red metrics, the gray, green, yellow, and red, we talk about every week. We remain in yellow. We have to go less than 43 cases. We're still in the low 50s. 50 was our low this past week. Our percent positivity was 2.14%. And the county itself was 4.12% and 669 cases over the 14 days time period. Going back up here to the slide there, we had a spike from the holidays, and also the spike started a couple weeks after a spike that occurred mid-Cape. There has been a spike mid-Cape over the past week or two in Barnstable and Yarmouth. So there's a chance that we may see an uptick in the next week or so if anything that happened, if it's similar to what happened the last time. So just, be forewarned that these cases may, because we're not that far away from Barnstable and Yarmouth, and they've had an issue with an increase in cases. Hopefully it doesn't happen to move to us, but just to let you know that, that's where we're at with cases. So we are watching that. So again, Falmouth had another decent week, 50 cases, so averaging right around 25 cases a week of case counts. So we're in the yellow again. We're still doing better than the state in terms of our incidence rate, but our percent positivity is slightly higher, and that's obviously based on the number of tests. We're averaging less than 3,000 tests now, where we were over 4,000 last year in 2020. The end of the back half of 2020. Here's what, and again, getting into where the cases are, you can see that Barnstable and Yarmouth had the higher incident rate over the past week. We've done fairly well. We've actually done real well throughout the pandemic. Our incidence rate's been quite low compared to other towns of our size. And so we can see that we've had a better week than average in terms of the larger towns in the Cape. And so we'll keep an eye on what's going on mid-Cape. And you can see the increase also in Barnstable County. This is all Barnstable County cases. I put a red arrow that shows that we're on a little upward trend. So hopefully we can flatten that out so we don't see something similar that we saw in January. Obviously, as we increase in vaccinations, the chances of the virus bouncing around from person to person goes down. So hopefully that and some good social distancing and outreach and good contact tracing keeps that and flattens that right out. That's what we're hoping for. As far as hospitalizations, it's been fairly consistent. I think we've been as high as 5 in the past week in Falmouth Hospital, but generally in the 2-3 range. Cape Cod Hospital's been in the low teens, that 10 to 12. They've been pretty consistent, so it's been fairly consistent with the levels. So as of yesterday, it was 2 in the hospital, 1 in the ICU at Falmouth Hospital. So pretty consistent there. As far as the state in terms of cases, it's been right around 1,500. Now we had an uptick to 1,800, been hovering right around the 1,500 range now for a little while. Averaging about 100,000 tests on days. Mondays are a little lower because over the weekend. The turnaround time for a test is about a day and a half. Our positivity has gone up a little bit. We're in the 1.8 range. We're at 1.93. About 500 people in the hospital. Under 100 are intubated, about 164 in the ICU. So as far as hospitals are concerned, that's manageable. Hopefully we don't see any upticks. There was the Brazilian variant was found on the Cape. There's things like that going on. There's new variants. But we're also increasing our vaccinations, so those two things, get on top of the vaccinations, and then the variants won't matter as much. So kind of hovering in that 15. And you can also see by the age range, it's definitely under 40 is the vast majority of the cases. You can see very little cases with comparatively, but over the age of 70. Well, one of the main reasons is we've done a lot of vaccinations at that age group, and so that might be an indicator. But most of the cases you can see have definitely been under the age of 40, and which is the reason why the hospitalizations haven't matched the cases. Again, pretty flat on the cases, slightly increased, but then you need a little bit more time. This tells you over time how we're doing. As far as deaths, you can see, and as far as positivity, we've sort of been under 2 for a little bit here. So we're sort of not in a bad pattern at all. It's pretty stable, right around 1,500 cases. And again, you can check this every day at mass.gov. As far as testing, nothing's changed. Again, you go through the hospital, through Cape Cod Healthcare's call center, through a physician's appointment. You can still go into CVS, Convenient MD, Community Health Center of Cape Cod. Also, you can book an appointment. It's not just Tuesdays. I think it's Tuesdays and Fridays for free at the fairgrounds. Just call the fairgrounds themselves at 508-563-3200. As far as gatherings, March 22nd, they're going forward with the 150, so 100 indoor, 150 outdoor gathering order. Ball fields, not counting fairs, festivals, road races, and other types of events, but ball fields like Fenway or Gillette would be at 12% capacity, anybody over 5,000 or more. Also, overnight camps and summer camps are going to be allowed to reopen. Exhibition and convention halls may reopen, subject to gathering limits. Dance floors may also open at weddings and events only. So some small, slight opening, sort of like a step 1, phase 4, step 1. And so we're working, towards opening up as we go. There's a travel advisory now. Used to be a travel order. So beginning on Monday, all visitors entering Massachusetts, including residents, are advised, instead of required, to quarantine for 10 days upon their arrival. Travelers are exempt from the advisory if they have a negative test administered up to 72 hours prior to their arrival. Okay. Also, you can have a test after your arrival as long as you're quarantined in between. Anyone who's returning to Massachusetts after an absence of fewer than 24 hours is exempt. If you're working on critical infrastructure, things of that nature, you can be exempt as well. If you're fully vaccinated, been 14 days since you're considered fully vaccinated, you're also exempt. And so that's our new travel advisory at the state, and that begins on Monday. Still want to limit as much as you can, just because, there's new variants out and you don't want to be the one to bring back one. So, again, diligence, it's still all the same: social distancing, traveling, reducing traveling. It's the parties, the gatherings. It's all the guidance that still needs to be followed. We're not at a point yet where we can just sort of forget about it. So we're still at that, we're still at the same phase. Same messaging for that as well. So as a recap, updated vaccine eligibility. Okay, Falmouth resident vaccines rates are similar to other Cape towns. And also, again, thanks to the Council on Aging, who's taking a couple thousand calls a week to help coordinate that list to Cape Cod Healthcare, because we've done very well at that age group because of that program. State metrics appear stable, maybe slightly up. We'll keep an eye on it. Falmouth, we remain yellow, averaging the 23 to 35 for the last 6 weeks. We are watching the Mid-Cape increase. Community spread still does occur. So regionally, vaccines are being administered as they arrive, and the supply is getting better. So we have a threefold increase on vaccine going to Barnstable County. In Cape Cod, healthcare is still getting theirs. Pharmacies are getting theirs directly from the feds. So, you know, as clunky as it seems it started, it seems like it's working itself out, and vaccines are getting into arms. And again, state has loosened guidance starting on 3/1, and again on Monday, 3/22, and then there's a new travel advisory replacing the old travel order starting on Monday. So that's our update for the week, and see everybody next week. Thanks.